So good afternoon to each and every one of you, and I'm delighted to introduce to you about the midwifery programme that we have here at UCD. So my name is Lorraine Carroll and I'm the Programme Director for the BSc in Midwifery. And during this presentation I'll give you an overview of the midwifery programmes that we have here at UCD, and I've also got two midwifery students on the panel as well, Arafa and Sabine, and we've got Liz, the clinical tutor, and Marcelina as clinical tutor, who are here to answer any questions that you have as well. So next slide, Suzanne, please. So as already been alluded by Suzanne, we've got a BSc Midwifery, which is a 4-year undergraduate degree, and we've also got the higher diploma, which is an 18-month postgraduate programme. So say, for example, you felt that you weren't going to maybe get enough points to get the midwifery degree, the 4-year BSc Midwifery, maybe you might choose to do nursing first, a nursing degree first, and then after 6 months you can apply for a higher diploma, a 18-month course. So you must be a registered nurse first to do a higher diploma in midwifery. Next slide. So what is the role of a midwife? What does a midwife do? So midwives specifically work with women and babies. They support and care for women during pregnancy, labour and birth, and after birth as well. Midwives help women to stay healthy during pregnancy and can provide sole antenatal care, so care during their pregnancy, especially if the woman is healthy and has an uncomplicated pregnancy, or it could be in consultation with an obstetrician, who is the doctor that looks after women during pregnancy. And during that time, the midwife is checking on the baby's growth, checking on the mother's health and well-being, and she's providing any necessary tests and offering support and advice to women during their pregnancy. Midwives also support women through their labour and birth, providing information and lots of emotional support. They monitor the woman's progress in labour and also monitor the baby's heartbeat and helping the woman to assist the birth of her baby. After the baby is born, the midwife then cares for both the mother and the baby, and also the partner involved as well. And that can involve assisting with breastfeeding to help the mother to breastfeed her baby, maybe to show her how to bath her baby, how to change those smelly nappies, and also perform newborn screening as well. Midwives can work in many different settings, and that can include the maternity units around Ireland, in maternity hospitals, community healthcare centres, or it could be as an independent self-employed midwife working in the community, or as a home birth midwife as well. So next slide, Suzanne, please. So as my colleagues have gone through their programmes, this is very similar, just to give you a flavour of what the student midwife journey is. So if you can see along the bottom, year 1 to 4. So in year 1 and 2, it's mostly about normal midwifery. So you're learning about the basic midwifery skills, such as doing abdominal palpation to assess the growth of the baby, doing anatomy and physiology, learning about how to take vital signs, blood pressure, temperature and pulse. Learning how to communicate with women is really, really important for midwifery, and there's aspects of psychology also involved in the first year as well. You learn a lot about labour and birth, normal labour and birth, and how to support women during their labour and during the birth of their baby. And also very much the role of the midwife is in promoting health as well, the well-being of the mother. Second year then moves on to looking at the woman and the postnatal care of the woman and of the baby, and more about the specialist role of the midwife as well. You also do shared modules with the children's in general students, the nursing students and mental health students on patient safety, microbiology, pharmacology, and you also have an opportunity to do an elective module, which can be any module across the university. In year 3 to 4 then, where you'll be looking more at the complex pregnancy, complex labour and birth, and babies that may be sick, and how to care for those babies. You'd also have shared modules with, again, the other disciplines on ethics and legal, sociology, and again, more opportunities to take 2 elective modules. Year 4 is about learning how to manage obstetric emergency. So if there was an emergency with a woman having her baby, that you would learn how to manage that. And then about preparing you for professional practice, preparing you for your internship, which is part of year 4. Next slide, Suzanne, please. So again, like the other programs, you're going to learn through lectures, using scenario-based learning, problem-based learning, tutorials, workshops, using presentation skills. We do a lot of e-learning and online activities as well. And you can see in some of those pictures, using the computer labs, the lecture theatres, that's the library, the bottom left, and then the skills lab and the bottom right. And that's some of our previous students that have learned how to do some suturing skills. And that's me there showing how to do neonatal resuscitation. Next slide, Suzanne, please. As I mentioned, you'll also do a lot of learning in the clinical skills lab, and this is important because it helps you to learn skills, and it helps you to develop your confidence in those skills and to prepare you for going to clinical practice, that you'll have practiced those skills in the clinical skills. And all those pictures that you're seeing in front of you now are all of our either current or previous students that have been with us here in UCD during the midwifery programme. Next slide, Suzanne. So in terms of the clinical placements on the BSc Midwifery programme, your clinical placements will predominantly be in the National Maternity Hospital, and you can review what the National Maternity Hospital on www.nmh.ie. It's one of the busiest and largest maternity units in Europe, and it has approximately between 8,000 and 9,000 births per year. So it's a very, very busy hospital, and I trained there myself. In second year, you also have an opportunity to spend either 8 weeks in either Wexford, Kilkenny or Mullingar maternity units. And then in fourth year, it's a 36-week paid internship, which is the same for all of the programs, nursing and midwifery programs. You spend 36 weeks out in your core maternity hospital, which would be the National Maternity Hospital. Next slide, Suzanne, please. During second and third year then, this is when the Nursing and Midwifery Board of Ireland stipulate the requirements that you must, placements that you must complete to register with them as a midwife. So for example, in between second and third year, you would spend 4 weeks in a neonatal unit in Holles Street. You'd spend 4 weeks on a gynae ward. You'd spend 2 weeks in the high dependency care, and that's split between St Vincent's Hospital and the National Maternity Hospital. And you also have an opportunity to do a 2-week elective placement, which is of the student's choice as well, but it must be maternity related. Next slide, Suzanne. Lots and lots of opportunities during the programme, and again, these are all of our either current or previous students. So there's opportunities, again, like the other programmes, for an Erasmus. You could spend a semester over in another European country. There's opportunities for fundraising for different charities. Some of our students have presented or attend conferences, midwifery conferences, plenty of awards up for grabs during the programme as well. And the middle photograph of some of our previous students who've received awards, academic awards, for achieving the highest grades on the programme. Lots of our students volunteer to be peer mentors, and that's a really important support mechanism for our students, in that, you know, as they've moved through the programme, that they become mentors to first years, to you as maybe as a first year coming into the programme, because as the other my colleagues have mentioned, it is quite overwhelming at first becoming into such a large university. And there's also opportunities for debating as well, and again achieving highest academic grades and more awards as well. Next slide, please. So at the end of the programmes and successfully completing all stages of the programme throughout the 4 years, you will be eligible to achieve your degree from UCD, but also be able to register with the Nursing and Midwifery Board of Ireland as a midwife. So in essence, you're getting two things. And there's next slide, Suzanne, please. There is lots and lots of career opportunities for midwives, registered midwives who continue as a registered midwife. With the Nursing and Midwifery Board of Ireland, you can work in a hospital or community setting. You've opportunities to work abroad in Canada, Australia, New Zealand and the UK, and we've had lots of our students go to those countries and then return to us again. You could be a clinical manager. Again, like the other programs, you have opportunities to become a specialist midwife, be it in diabetes, maybe in ultrasound scanning, or a bereavement midwife. You may like to specialise in breastfeeding and become a lactation consultant, or maybe become, like me, a midwifery lecturer. You could also be a self-employed community midwife, or a GP midwife, where you're a midwife working in a GP scheme. Or you may like to become a midwifery researcher either. So lots and lots of opportunities there for midwives. We are on social media, so do please follow us if you're interested in midwifery. We're at UCD Midwifery. We're on Facebook, Instagram and Twitter. And next slide, Suzanne. And today we're actually putting on a further questions and answers. So if you're really interested in midwifery and like to talk to us a little bit more, myself and Liz, and we're going to have Sabine, one of our students, live on Instagram from 2:30 today. So just follow us at UCD Midwifery. Share it with your friends if they haven't been on, if they're not on this webinar. Do share it with your friends and come and join us and ask us any questions that you may have. So 2:30 today at UCD Midwifery on Instagram. Next slide. So that's my presentation, and please ask any questions that you might have, and I wish you the very best of luck in whatever your career choice might be, and I'm delighted to have been able to speak with you today. Well done.
Are there any misconceptions about midwifery or any type of nursing that students should know about before choosing the course, not course?
I don't mind taking this one. My name's Sabine, and I'm a second year student midwife of the BSc Midwifery programme. And a lot of people told me when I was going into midwifery that it's just about delivering babies, but it's so much more than that. Like it's like looking after women throughout their whole pregnancy, offering breastfeeding advice, nutritional support and emotional support throughout their pregnancy. And like midwives are there for some of the most joyous and challenging moments in a mother's life. So it's not just about delivering babies, it's so much more than that.
Here, have the midwifery students liked their course so far? I'm going to say that, I'm sure it's a yes, but I'd like to hear it from them maybe.
Definitely. Well, I definitely have anyway. I don't know about if Arfa wants to take this one.
No, yeah,
Arfa.
I have. Just, adding on to what Sabine said about that colour misconception, I honestly came in thinking it was just about delivering your baby and that was it, but there's so much more, and I'm really loving it.
Thanks, Arfa. Okay, would it be better to train as a nurse because of the competition for places on midwifery degrees? Do you know, the midwifery team want to answer that?
I'll take that one, Suzanne. Yes, that's a very common question that we get. I suppose up to when I was training, up to even 12 years ago, you had to train as a nurse first before you could become a midwife. That has all changed now. So if you really, really, really want to become a midwife, you can do the degree course. The thing is, I suppose can be a difference between the points, I would say. Often the points for nursing can be slightly lower than for midwifery and for children's and general nursing. So if you really feel you really want to be a midwife, sometimes it can just take that little bit longer, but that's okay. So go do your nursing first maybe, and then come back to us and do your 18 months midwifery. But if you feel you're going to get the points and really, really want to be a midwife, it's very different to nursing. Then look to do the BSc midwifery course is what I would recommend, because it's 4 years as opposed to 5.5.